local spokesperson, our local board, as well, having an interesting angle for the country. And sometimes it was very, very rich to communicate on that, not to stop only to the global research, but sometimes speak less in some specific countries.
Okay, so the importance of the local board is to adapt or even generate new research that is relevant to the skin conditions or ethnicities of the local market.
Yes, and it was also helping when we were participating to Dermatologist Congress. It was also helping a lot to have something new to say and something relevant. So, in all this Congress, I don't know if you have participated to medical Congress.
In the US, we have been doing that in the US as a US origin brand, but we haven't done it outside of the US.
Because we were doing that in all the countries, L'Oréal was participating to medical congress in every single country. And it was very interesting to have local research, local studies, because you could have, they always have conferences, classroom. So it was a good way to spread the word. First of all, we had stands. So we were present with dermatologists on our stand, presenting our innovation, presenting the product, presenting the results of the survey. But also we were animated classroom, debate, and presentation. And all that, of course, is not fast marketing. But slowly but surely, after a few years of participation, L'Oréal had a big credibility in terms of, yes, L'Oréal products are really serious. They're serious people. They don't only do marketing. They work with us. They're combiners. They've been partners for years. And we were always, when Brazil is a platinum partner of all of the Brazilian Dermatology Society. So suddenly you get at the same levels than some pharmaceutical companies. You enter and then you gain credibility and they listen to you. Because, for example, if L'Oréal Paris, the brand L'Oréal Paris, was to enter a congress, nobody will talk to them because they just have a famous personality pretending something that nobody trusts. But it was something that really was gained after years, but it was extremely powerful. And a lot of the success of active cosmetics today is also this heritage of years of investment, building a credibility within. Doctors are slow to convince. Consumer, you can convince them fast. Doctors are slow. So if you want to have dermatologists, consider that, first of all, you need to have something new to tell them. So a story they haven't heard. You have to have a way to demonstrate that to them, that you have done serious things. And if you want to be part of them, you have to work along them. You cannot just go and make one appearance and then thing is done. You can do that with a marketing campaign. You cannot do that with doctors. So it's innovation, if you want to interest them, something they don't know. Prove them, have a serious study, and be part of them. And then suddenly they adapt, they accept you, and they start to prescribe. And that's really, it's a capital building. It's not, you can do things fast on TikTok. This is capital building. This is assets that you build.
Okay. And just in terms of that work with that community, the dermatologist community that, as you said, takes years, how have you seen that the configuration model built in order to be able to support that? Is that normally an in-house model, or do you use an external PR agency, or how would you recommend the best way of resourcing and configuring to be able to support that?
So it's certainly not PR agency, because it's really somebody that the scientific doctors, dermatology, they see a lot of patients, they do quite a commercial job, but they still want to be a scientist. So put a pure PR person, that's typically the person they don't want to see. I mean, you will have the exception, but usually they like scientists. They